Hello guys, how are you doing this evening? Okay, welcome to this session, and today I'm just going to take you through a brief session on what was requested by one of you, and that's a part of reevaluation date. Remember, the request is reevaluation date, so a date should appear there ideally, because you have to be exact on the time unto which this patient will be reviewed. Yeah, so it's either reevaluated today, then you state the period, or you write the date itself. Whichever that is applicable to you or easy to you will work. And this is what I mean. The reevaluation date depends on the various scenarios that are being handled in OSCE. We usually have the neuro patient, the PHQ-9 patient, news patients, post-op, pre-op. So it will depend with these cases that you will be provided with. For instance, for the post-op patient, under monitoring is supposed to be 15 minutes for 1 hour, 30 minutes for the next hour, and hourly for the next 4 hours. Yeah, but if your care problem is pain, then you will just state that to be reevaluated today every 30 minutes, okay, or more frequently if the condition changes, because you are the care you are taking into account is the pain, and the patient shouldn't have that pain for long. When your new score seem normal, you need to ensure you adjust it to fit the patient needs. So things like pain, you would review them in 30 minutes. Now, for the news chart, which is very easy, usually you will be provided with, you will score your patient. If your patient has an aggregate score of 0 to 4, they have low clinical risk, and that one they will be evaluated after every 4 hours. Okay, but should you get a red score anywhere, a red score, I mean a 3 in any of the parameters, then the reevaluation date goes to hourly automatically, because the risk is rising. Yeah, so that one is usually provided at the back of your news chart, so it should not worry you on how to determine whichever score you will have and how frequent you should use it. So just ensure you score your patient using the parameters, the BP and all that, and the score check from the backside of your sheet, and determine how frequent your patient ought to be monitored. Yeah, and at the same time, take note of the 3, because that's what usually confuse many people. Maybe a patient has only high temperature and the other parameters are normal. The moment it's a 3, then the reevaluation date goes to hourly, okay, irrespective. Some are even immediate, and the moment there's anything alarming, then under the point of would you escalate, or under point of escalation, you would put a yes. Unless all the patient's parameters are normal, that's when you will put a no for your escalation. So that is for news, and news will include even pre-op, patients being prepared for theater, things like a patient being prepared for hernia repair, or maybe fracture adjustment, or things of that kind. If it's a PHQ-9 patient, the reevaluation depends on what you are checking. Maybe this patient for PHQ-9 is low mood, okay, and these are patients who are at home, so you will reevaluate them on a weekly. You will assess the PHQ-9 score on a weekly basis, so you will state under the reevaluation to be reevaluated every week, okay, or more frequently if the condition changes. That one will fit the PHQ-9 patient. That one will also apply to most patients, because The mood score is also assessed weekly during the community nurse visit. So those are considerations you need to put there. For neuro patient, if the GCS score is less than 15, then reevaluation date turns to be today, because they are in hospital setup. Today, every 30 minutes, irrespective, unless the GCS is 15/15, that's when they can be assessed, maybe after 4 hours, 6 hourly, or 12 hourly, depending on the other parameters. But anytime that the GCS score is less than 15, your reevaluation date goes automatically to today. You have to write that word today, because some people have gone back to write their exams because they did not indicate the date. So when you say today and you've written your exam, like say 28th of November, so with that one, it is covered in that paper sheet, okay, in that sheet. But you can opt to write the date itself, to be evaluated 28/11/2021, every 30 minutes until the GCS is 15/15, or more frequently if the condition changes. Those are considerations you need to make, and they are a bit different with they might capture an aspect of monitor and recording, something of that sort, but the individual aspect that you need to consider is the care problem you are handling, okay? And that is very key. For example, in a pre-op patient who is having normal values, okay, patient is being prepared for hernia repair and all other parameters are okay, according to your new score, the patient needs to be observed 4 hourly. Remember, that might not apply because this is a patient who is being prepared for theater. So you can say the vitals to be reevaluated, or to be evaluated today, every 15 minutes or 30 minutes till the procedure period, or more frequently if the condition changes. That one makes sense, as opposed to be evaluated every 4 hours, yet the surgery is just being prepared. The scenario will tell you what is expected. So that's more of application of what is provided and how you assess your patient. Remember, it is patient-centered care, so you should really consider your patient for that case. So with that one, I'm very sure you are very comfortable with the reevaluation dates. Only remember the aspect of today. Ensure you write to be evaluated today for those aspects that are being evaluated today. For PHQ-9 and most, you will just to be evaluated every 1 week, or more frequently if the condition changes. PHQ-9 and most. Neuro, post-op, anybody who is in hospital setup, you won't reevaluate them weekly or 12 hourly if they have a problem. That's the assumption. These other aspects are for those who are at home, either care home or their residential areas. So provided somebody is in the hospital, you can't even be penalized because you are monitoring patient more frequently. So that would work to your advantage. If the scenario is talking of a patient in a care home and your issue is most, but the problem now you are handling is about sleep, yeah, maybe the patient has sleeplessness, it is the most that you will monitor weekly, but sleeplessness you will monitor every 4 hourly. And what we mean by this is the aspect, because the intervention you will put in place ought to be implemented as the day moves along. Maybe you've talked about rest, or maybe engaging in activity during the day so that one can get tired and have a bit of resting at night. So you would monitor such interventions 4 hourly. So if the patient is a most patient, the the aspect of poor diet can be monitored weekly, or depending on your situation, just consider what is provided for you. If the patient is in a care home and your care problem one is about poor nutrition, you've made some interventions, then you ought to monitor these aspects that you have intervened against, maybe 4-hourly, because this somebody is under your care. If the issue is sleeplessness, monitor it even 4-hourly, 6-hourly, you won't be penalized. 12-hourly might be a bit long, but anybody who is under a structured program of examination can be monitored 4-hourly, 6-hourly. That would apply for people in hospital and care homes. If the patient is at home, that's when the weekly aspects get in. Even the PHQ-9 patient, if they are at home, that's a weekly issue. But if they are in hospital, care home, then the assessment changes. It's only the PHQ-9 score that might be monitored weekly. The other aspect, if they are having issues with their self-care activities, and maybe you've referred them to social care services, you've involved the family, then you assess such intervention, or you evaluate such things 6-hourly, 4-hourly, and that would apply. I hope that makes more sense to you. And in general, what I would just say, consider where is the patient. If the patient is at home, in their usual place of residence, definitely to be reevaluated on a day, every week, and that is for majorly PHQ-9 and most. Now, if they are in care home and the care problem you are handling can be assessed more frequently, then you will go for that. That can either be 4-hourly or 6-hourly. The other patients who are having other problems, for news patients, chest infection, asthma, those ones are monitored according to the news score. Yeah, the score is what you've scored the patient, then check what is provided, all the risk on the backside of that paper you will be provided with. With that one, you will have a clear guide on the reevaluation date. Thank you so much, and I appreciate you. I wish you well as you go to undertake your OSCE, and kindly continue subscribing to my channel and get more info concerning OSCE as well. Thank you, and bye for now. See you then.